Nurse Aide Examination Candidate Information Bulletin. Question 1. When documenting client care, the nurse aide should: Option A. Use vague descriptions. Option B. Be objective, accurate, and use only abbreviations that are approved. Option C. Include opinions about the client. Option D. Write in pencil so errors can be erased. The correct answer is option B. Be objective, accurate, and use only abbreviations that are approved. Documentation should be objective, accurate, and use only approved abbreviations. Opinions are not appropriate. Pencil should not be used. Documentation should be in ink. Question 2. Which task is outside the nurse aide's scope of practice? Option A. Applying a gait belt. Option B. Recording output. Option C. Changing a sterile dressing. Option D. Offering a bedpan. The correct answer is option C. Changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 3. The nurse aide is caring for a client who speaks a different language. The best approach is to: Option A. Use hand gestures and hope the client understands. Option B. Speak loudly and slowly. Option C. Use a trained medical interpreter. Option D. Ask another client to translate. The correct answer is option C. Use a trained medical interpreter. A trained medical interpreter is essential for accurate communication. Hand gestures are insufficient. Speaking loudly doesn't help. Using another client violates confidentiality and may result in errors. Question 4. The chain of infection includes: Option A. Pathogen, host, transmission route. Option B. Air, water, food. Option C. Bacteria, viruses, fungi. Option D. Skin, blood, mucous membranes. The correct answer is option A. Pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example: hand hygiene breaks the mode of transmission. Question 5. Which method of temperature measurement is considered most accurate? Option A. Oral. Option B. Axillary. Option C. Tympanic. Option D. Rectal. The correct answer is option D. Rectal. Rectal temperatures most closely reflect core body temperature and are considered the gold standard. Oral temperatures are affected by eating and drinking. Axillary temperatures are least accurate. Tympanic readings can be affected by earwax and positioning. Question 6. The compression to ventilation ratio for adult CPR, single rescuer, is: Option A. 15:2. Option B. 30:2. Option C. 5:1. Option D. 10:1. The correct answer is option B. 30:2. For adult CPR by a single rescuer, the ratio is 30 compressions to 2 breaths. This is the American Heart Association standard for effective CPR with minimal interruption. Question 7. Normal adult respiratory rate is: Option A. 8 to 12 breaths per minute. Option B. 12 to 20 breaths per minute. Option C. 16 to 24 breaths per minute. Option D. 20 to 28 breaths per minute. The correct answer is option B. 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 8. In the event of a fire, the nurse aide's priority is to: Option A. Extinguish the fire. Option B. Rescue clients from the immediate danger area. Option C. Call the fire department. Option D. Save the client's belongings. The correct answer is option B. Rescue clients from the immediate danger area. The priority is to rescue clients in immediate danger: race, rescue, alarm, contain, extinguish. Extinguishing the fire, calling the fire department, and saving belongings are secondary to client safety. Question 9. A client is bleeding profusely from a wound. The nurse aide should: Option A, apply direct pressure to the wound. Option B, apply a tourniquet. Option C, elevate the wound. Option D, apply ice. The correct answer is option A. Apply direct pressure to the wound. Direct pressure with a sterile dressing is the first step to control severe bleeding. Tourniquets are for life-threatening bleeding not controlled by direct pressure. Elevation and ice are not as effective. Question 10. When disposing of contaminated linens, the nurse aide should: Option A, shake them out before placing in the hamper. Option B, place them in a leak-proof bag without shaking. Option C, fold them neatly before disposal. Option D, sort them in the client's room. The correct answer is option B. Place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 11. When assisting a client to walk, the nurse aide should walk: Option A, behind the client. Option B, next to and slightly behind the client, holding the gait belt. Option C, in front of the client. Option D, far to the side of the client. The correct answer is option B, next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 12. The nurse aide is performing perineal care on a female client. The aide should: Option A, wipe from front to back. Option B, wipe from back to front. Option C, wipe in circular motions. Option D, wipe in any direction. The correct answer is option A, wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 13. Which is a violation of HIPAA? Option A, discussing client care with the client's family who is present. Option B, discussing client information in the elevator with another aide. Option C, documenting care in the client's chart. Option D, reporting client information to the nurse. The correct answer is option B, discussing client information in the elevator with another aide. Discussing client information in public areas, elevators, cafeterias, hallways, violates HIPAA because conversations can be overheard. Discussing with family present, documenting, and reporting to the nurse are HIPAA compliant. Question 14. When applying a gait belt, the nurse aide should place it: Option A, around the client's chest. Option B, around the client's waist, over clothing. Option C, around the client's hips, under clothing. Option D, around the client's neck. The correct answer is option B, around the client's waist, over clothing. A gait belt should be snugly around the client's waist, over clothing, not bare skin. Not over the chest, restricts breathing, not under clothing, skin irritation, and never around the neck. Question 15. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 16. What is the correct procedure for taking an oral temperature? Option A, place thermometer under the tongue, close mouth. Option B, place thermometer under the tongue, breathe through mouth. Option C, place thermometer between the teeth. Option D, place thermometer on the tongue. The correct answer is option A, place thermometer under the tongue, close mouth. The thermometer must be placed in the sublingual pocket with the mouth closed. Breathing through the mouth or placing on the tongue leads to inaccurate readings. Placement between teeth risks breaking the thermometer. Question 17. When a client is being discharged, the nurse aide should: Option A, assist with packing and ensure the client has their belongings. Option B, tell the client to call if they need help. Option C, let the client pack alone. Option D, rush the client to leave. The correct answer is option A, assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 18. When measuring intake and output, INO, the nurse aide should record: Option A, only water the client drinks. Option B, all fluids consumed, including ice chips, soup, and gelatin. Option C, only oral fluids. Option D, only 4 fluids. The correct answer is option B, all fluids consumed, including ice chips, soup, and gelatin. Intake includes all liquids and foods that become liquid at room temperature, such as ice chips, soup, broth, gelatin, juice, milk, and water. Recording only water or oral fluids misses significant fluid sources. Question 19. A client is grieving the loss of their spouse. The nurse aide should: Option A, tell them to move on and focus on their health. Option B, listen and acknowledge their loss. Option C, avoid mentioning the spouse to prevent sadness. Option D, suggest they should be grateful for the time they had. The correct answer is option B, listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated. Question 20. Which of the following can cause an inaccurate pulse oximetry reading? Option A, nail polish. Option B, client holding their breath. Option C, client sleeping. Option D, client sitting up. The correct answer is option A, nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 21. A client with depression refuses to get out of bed. The nurse aide should: Option A, allow the client to stay in bed. Option B, gently encourage the client to get up. Option C, force the client to get up. Option D, call the family to get them up. The correct answer is option B, gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 22. When performing chest compressions on an adult, the nurse aide should compress the chest to a depth of: Option A, 1 inch. Option B, at least 2 inches but no more than 2.4 inches. Option C, 3 inches. Option D, 4 inches. The correct answer is option B, at least 2 inches but no more than 2.4 inches. Adult chest compressions should be at least 2 inches deep but no more than 2.4 inches. 1 inch is too shallow, 3 to 4 inches may cause injury. Question 23. When counting respirations, the nurse aide should: Option A, tell the client they are counting breaths. Option B, count while appearing to take the pulse. Option C, count for 10 seconds and multiply by 6. Option D, count for 30 seconds and multiply by 2. The correct answer is option B, count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 24. A client has difficulty adjusting to a new facility. The nurse aide should: Option A, tell the client they will adjust. Option B, allow the client to express their feelings. Option C, leave the client alone to adjust. Option D, call the family immediately. The correct answer is option B. Allow the client to express their feelings. Allowing expression of feelings helps the client process the transition. Telling them they will adjust, A, is dismissive. Leaving them alone, C, may increase isolation. Calling the family, D, may be appropriate but not the first step. Question 25. A client who is agitated and wandering should be: Option A, restrained to ensure safety. Option B, redirected calmly to a safe area. Option C, left alone to tire out. Option D, given medication to calm down. The correct answer is option B, redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication.